All right, it's good.
Okay, so take it away.
All right, guys. Welcome to another episode of the Clearfield Show, as I like to call it. Tune in every Tuesday for a great show. My name is Stefan Hartman. I'm a PA and owner of Iron Direct Primary Care in Indy, Atlantic, Florida. We're an anti-aging and functional medicine practice. And today I'm giving you guys a special preview of my lecture I'm going to be giving in Bologna, Italy. If you guys want an excuse to go to Italy, take a CME vacation, it's 7th and 8th of November in Bologna. Fantastic food, great culture, amazing location, really central to, Venice and Florence, day trips, really. But this is a conference is going to be focused on brain optimization. So all the talks will be both Italian and English. And I will actually be giving this lecture in Italian in Italy because I speak Italian. Today I'm going to be giving it to you all in English. And I've never really written a presentation like this. You'll see both Italian and English words simultaneously on each slide for this. So I apologize for the Italian writing on it. But the whole conference is about brain optimization, mental health, how to fix that, and they're both international and Italian speakers at this conference.
One suggestion though, in the bottom left there, instead of whoever that is in the tub, I think you should have put Dr. Halassa in there.
I put it, he only spent a second in there. He didn't give me enough time to take a picture. This
Well, I
is
saw something he was getting in.
this is
That
another
was it.
doctor who visited me. This Italian doctor. He spent 2 weeks at my clinic. He stayed at my clinic. And any doctor of you is welcome to come staying and hang out. It's a home actually, so you can hang out and do wellness retreats. I want to start getting more doctors to our office and get them into our wellness routine, the exercise, the cold plunge, the sauna, the red light therapy. I want to start teaching doctors how to get themselves healthier so that they can help their patients better. But this is Dr. Paolo Conforti, you can see in the left lower quadrant here, and he's an Italian functional medicine doctor, and he's organizing the conference as well, so he'll be there speaking.
Okay.
So there's four pillars, four things I like to frame mental health around. One is the lifestyle, the diet, the training, the sunlight. We all know about these things. We may not implement them, but we know about them. The second most important one I found is the nutrient deficiencies, which we're going to show just how epidemic this is. And then always there is some level of like a pain, whether it's emotional pain or physical pain. I actually worked in psychiatry for a time. And as a PA, there's a lot of lateral movement. It's one of the best things about the profession is that you can move to different specialties and you get a whole experience of that. So I worked in psychiatry for a time, and a lot of the patients had multiple overlapping diagnoses. And there was a trend. The patients typically had a diabetes component, they had a mental health component, and there was oftentimes a pain, a physical pain component. And they were on sometimes overlapping psychiatric drugs that will both treat the depression, anxiety, but also treat the pain, because there's always a pain that goes along with it, it seems like. And then hormone optimization, because as Dr. Clearfield has lectured many times before, hormones are critical for everything that you're trying to optimize. Um, there's many types of pain. You can have traumatic brain injury. There's gut inflammation. That's an insult. There's back pain. There's neck pain. There's autoimmune inflammatory processes. There are a lot of types of pain and inflammations, and we need to address every one of them when we're treating a patient with brain. Because if there's inflammation somewhere in the body, there's probably a brain inflammation as well. So I've given this talk before in this lecture hall about the advantages of cold submersion therapy, and I found it to be one of the most powerful therapies in both conventional and alternative medicine. Again, as a PA, I had a bit of lateral movement. I worked in spine surgery and pain management for a time. And we did a lot of spine surgeries. We pushed a lot of corticosteroids in people's joints. We did a lot of radiofrequency ablations. And these patients, they would get some benefit from that, but then they have to come back. And there was a lot of problems with these therapies. The results weren't always that great. And there was always an inflammatory component to every one of these patients that I saw. So at my clinic, we've been doing a kind of a case series, and assessing people's response to the cold submersion therapy. Now, mind you, we keep ours very cold. It's about 35 to 36 degrees Fahrenheit. And what we found over this case series is that their mood improves. We sometimes get remarkable improvements in their mood. Like they'll have like a terrible mood, which will they'll rate as a on a 0, and then after the cold plunge, oftentimes it'll be upwards of a 10. They get this euphoric feeling from the neurotransmitters, the dopamine that's released. It's not a cheap dopamine. It's not like doing a hit of coke. It's not, doing some ecstasy. This is a cold. It hurts to get in there, but the reward is a true dopamine response, and it's healthy form of dopamine. But the pain management is tremendous. We'll find typically that patients will get a near instantaneous resolution in pain after a cold plunge, whether it's acute, chronic, no matter what it is. I've rarely seen, I don't think I've actually had anyone not improve their pain within exiting the cold plunge. And you don't get that anywhere else in medicine. No other therapy can promise an instantaneous relief in pain. There's a lot of studies out there. A lot of the studies are on cryotherapy chambers where you walk in as a nitrogen chamber at really cold temperatures, like 240, negative 240 degrees Fahrenheit, used for severe conditions like adhesive capsulitis, osteoarthritis, and it works. But it's very expensive, so I didn't get that from my clinic. Mine is the cold, and it actually, from I've had patients do both. The wet cold is actually, it sucks more than the walk-in chambers. So patients who have done both report that it is more challenging to do a cold plunge than a walk-in cryotherapy. Here's another one reported a pain improvement or a mood improvement from 4 to 9. The pain greatly interfered with the enjoyment of life. So the patient, if they had gone to a psychiatrist, the psychiatrist would say, well, this patient has anhedonia. They have no enjoyment of life. We should probably give them some Prozac or something. But this patient, through regular cold plunging, and mind everybody is a member, it's not just a one-time thing. As a member of this, my wellness center, they do cold plunge on a regular basis. Arthritis and cryotherapy, the cold therapy has immunomodulatory effects. So when you have a pathological condition that is destroying the joints, like arthritis, rheumatoid, or osteo, the cryotherapy, um, it helps with the pain. It can help their movement, and it can actually be disease modifying because it lowers certain inflammatory cytokines. Here's another patient, 62-year-old, pain level 9 out of 10 after cold plunge reduced to 1 out of 10. Mood improvement from 3 to 7, and pretty rapid improvement too. What else does cold plunge do? It modifies your white adipose tissue to brown adipose tissue. It's one of the only known therapies to do this. There's no real drug to do this. It takes hard work. You need to exercise, you need to lift weights, but cold plunging can change this inflammatory white adipose tissue that releases so much more inflammatory signals that cause not only pain, but they cause general inflammation. Every organ system is affected by this white adipose tissue. It's on your organs. You may not know you have it, um, but you can change it with difficult things, like cold exposure. This is that same patient after 10 weeks of ice therapy. The mood is still great after he does this. And he was doing it for a piriformis and sciatica, which was pretty debilitating. And mind you, all these patients, they've done other things. They've done ibuprofen, they've done chiropractic, they've done physical therapy. Some have gotten some pain management procedures done. But the cold is either equivalent or better than a lot of these therapies. This patient left me a nice Google review. He says this place saved my life. This is a very powerful statement. Sauna. So sauna is part of the lifestyle pillar. It helps with detoxification. It also has a nice growth hormone boosting effect. I don't know if you guys knew this. If you do 175 degrees Fahrenheit, 10 minutes in, take a break, 10 minutes again, you get a nice IGF-1 boost, which is great for regeneration and healing. It protects against dementia. This is why I purchased a traditional Finnish sauna. I didn't buy a red, an infrared sauna. I got a sauna based off the literature, which is comes out of Scandinavia, showing that regular sauna use decreases dementia. So that's huge. I think all patients should be using sauna on a regular basis. We're so polluted with chemicals. When we run the panels, not a single patient has come back with a normal toxic profile. Everyone has toxins. Everybody needs to be detoxing on a regular basis. And sauna is just one of the many ways we can detox through sweating and through increasing your body's temperature, which we all, popular media has sensationalized the negative effects of Tylenol. I always tell my patients we don't treat a fever, we allow the body to naturally warm up when we have a fever. It drives me nuts when parents tell me, I've been treating the fever with Tylenol, ibuprofen every 4 hours, like the bottle says. No, you treat the patient if they're miserable, if the child doesn't sleep at night and they're sick with a fever, okay, give them a little bit of Tylenol. But we don't treat a fever. Uh, Increasing the body's temperature is a natural mechanism. It helps the body detoxify. It inactivates viruses. So don't get me started on that. Uh, Sauna to treat chronic fatigue syndrome. This might just be because the body is detoxing heavy metals, detoxing pollutants, but it can also help treat chronic fatigue. And I tell you, chronic fatigue was ubiquitous when I worked in psychiatry. Every patient had fatigue. When I worked in psychiatry as a PA, they told me to be a good boy, stay in your lane, just prescribe the SSRI, don't test hormones, don't give him any vitamins, don't give him even vitamin D. Like I got in trouble for advising patients to take vitamin D and folate and B12. It's nuts in conventional psychiatry. I only lasted like 6 months before they fired me. But every patient had fatigue. And like, what are you going to do in psychiatry for fatigue? Oh, I guess Wellbutrin's a little bit stimulatory. Let's give them some Wellbutrin. No, it's junk medicine. You gotta treat the whole patient. And that's what this whole lecture is about. We're gonna keep getting into that. And sauna is just one of the many tools in our toolkit. Sauna effects on the endocrine system. We talked about earlier. It increased growth hormone levels. So when you have this release of noradrenaline, antidiuretic hormone, which actually, if you listen to Dr. Thierry Hertog talk about, he actually will give his patients sometimes desmopressin. He'll give them some of these hormones that we don't use so much. I don't know if Dr. Clearfield's talked about that very much. Maybe talk about that later. But sauna can actually trigger some of these things, growth hormone, beta endorphins. And you feel good. Endorphins help pain, help people feel good. It's good for the mental health. We move on to another one I like, very briefly here, red light therapy, just because it saved one of my patients from suicide. She had terrible trigeminal neuralgia from a herpes virus, infected her nerves. She couldn't get any relief. She tried gabapentin. She was thinking about getting surgery. She was going to go to Mayo Clinic, get this innovative surgery. I guess they're going to like rhizotomy procedure of the trigeminal nerve. Sounds kind of dangerous to me. But I prescribed her red light therapy, which we have at our office, and she went to a physical therapist, and she had near 99% resolution of her trigeminal neuralgia pain, and she was on the brink. So that was pretty powerful. And the red light, the infrared and red light, it has regenerative effects on the nerves. It does penetrate deeper through the tissue. If you get up to 688 nanometers, it gets through down to the fascia, the muscles, ligaments, but nerves especially, it's fantastic for healing inflammation and autoimmune problems. So it acts with nerve regeneration, boosts cellular energy, reduces inflammation, improves blood flow, modulates brain chemicals, can help alleviate pain and enhance nerve function. So we love red light therapy. Strength training. I'm a huge fan of strength training. I invite any doctor here listening to come train with me at my gym. I'll put you through the Dr. Halassa routine. He complained every rep, but we got him through a session. It was great. Uh, Strength training helps with pain. Now, when I worked in pain management and orthopedic surgery, How many patients do you think walked through the door of the thousands that looked like me? Did they have good musculature? Were they these buff guys who had deadlifted a bunch of weights? Were they there for a spine surgery because they were weightlifting? No. I don't think we had more than maybe two in the time that I worked there. They were not athletes. These were people that were collapsing in on themselves. They were sarcopenic. They had no muscle. So when you get this aging muscle, you get this frailty, you get this collapse. Not only do you have less resistance to gravity, you're collapsing in on your own spine, you're going to have more arthritis because you literally your facet joints are collapsing in on one another, so you're rubbing it every time you move this way and that. But you have altered cytokine signaling. You have more of this inflammatory cytokine response. And sure, you can take drugs, right? We talk a lot about the repurposed drugs that we could use to modify the inflammatory cytokine release. But if you have a robust musculoskeletal system, you have less of an abnormal cytokine response to various tissue injuries, infections, viruses, bacteria, and so you have a better response, better immune response to pain, really. And then, of course, the diabetes and insulin resistance. This is another thing I saw all the time in psychiatry. The patients were on metformin, Jardians, they were on Ozempic. Their blood sugars, they were out of control. They all seemed to have some level of an insulin resistance as well. Very rarely would it be an athletic young man come to me, and they were probably there for ADHD, which is another story. But the depression, the anxiety, oftentimes a diabetes and insulin resistance goes along with that. And that shares a problem with the lack of muscle, lack of training. They have an altered inflammatory cascade in this insulin resistance diabetic model. And then, of course, the diet. This is an average kitchen inventory that I did back when I did house calls starting the practice. And I saw this every day when I went to go do house calls. It was processed junk, it was seed oils, fake mayonnaise, high fructose corn syrup, junk. You couldn't find 100 grams of protein sometimes in someone's fridge. I mean, where was the real food? It wasn't there. So people are eating processed foods. So of course they need to remove that from the diet. They need real foods. It goes without saying. High omega-3s, lower omega-6s. And we all know the benefits of omega-3. Here's just something at a glance. Improves neuronal membranes, improves synapses, myelin sheaths, which, those myelin sheaths, they seem to degrade in a lot of these neurodegenerative conditions where you have improper firing because there's this fatty layer on the myelin sheaths on your nerves and they degrade and you have problems. You get poor motor nerve control. So this is my mom, Manja Pesce. She loves fish. She's found that omega-3s, specifically from wild-caught mackerel, are the best thing for her brain. And specifically wild-caught. Let's talk about salmon, because she actually went out of her way to figure out how they were farming salmon in Scotland and Norway. So if you go to the supermarket and you get a farm-raised salmon, or they say it's like ocean-raised salmon in Norway, they're feeding them rapeseed oil. So this is not a natural food for the omega-3 high fish. So if you feed a rapeseed oil to fish, that's high omega-6. So the meat profile of that salmon becomes no longer high omega-3 like it's advertised, it's a high omega-6 fish, right? We can do blood tests on people and we can see what they're eating. You can see super low omega-3, you can see super high omega-6, and I know exactly that they're not eating omega-3 rich diet. The same can be applied to the fish, and then when the fish is high omega-6, you're not going to get high omega-3 from eating that farm-raised salmon, unfortunately. So we need to know the quality of where the fish is raised. If we assume that omega-3 has a lot of benefit, we need to make sure we're actually getting omega-3. Now,
Stefan, can I interject one thing real fast?
yes, please, Dr. Quinn.
Okay, the we might have talked about this before, but the fish, the omega-6, omega-3, basically the fish doesn't make the omega-3. The fish gets the omega-3 from the algae that it eats. So when you have farm fish, they're not eating algae, they're eating pellets or something else like that. That's why they're not getting an omega-3. You're not getting omega-3 from them.
Right, right. It matters a lot. and cooking as well. We don't want to overheat the fish when we cook it because it spoils and will denature. It burns. There's a smoking point that's very delicate. So you will denature your and you will oxidize your fish as well if you cook it too hard. And sourcing your meats matters as well. The grain-fed cow has such a problem with liver abscesses that they're attempting to develop a vaccine instead of just feeding the cows right. You put the cow on a pasture and they eat grass like they should, they're not going to grow liver abscesses. Now, I get the argument that cows are only fed grain in the last part of their lives before slaughter, and that's true in some cases. But when you do that, you're going to change their meat profile. When you feed them grains, that's typically high omega-6. And so their meat profile no longer is omega-3, which a grass-fed cow should be a decent omega-3 meat. But it ends up not being the case too many times. And then I see this all the time, and I'm giving this lecture in Italy, so I might get some laughs out of the crowd there. But I read these Western medical journals, and oftentimes they'll recommend the Mediterranean diet. You've probably heard that somebody said, the Mediterranean diet, it is the best thing for all these conditions, mental health, diabetes. But what is a Mediterranean diet? It comes to the ingredients. So this is a picture we took in Florence. You can see the gate behind us there. Florence has rules and regulations that require that the restaurants in that area source all their ingredients locally. Italy also bans glyphosate and they ban bromide. And when they cook the pasta is cooked al dente. And so if you have a wheat that's not been denatured with glyphosate and bromide, and then you are not cooking it super heavily and hard either. And so that lowers the glycemic index of the pasta as well. And then there's the slower meals there. There's the better wine that doesn't have glyphosate. Like if you measure the toxicity level of wine from California, it's pretty much all glyphosate ridden, right? It's a really big problem, unfortunately. I don't know if it's super easy to recommend a Mediterranean diet here in the US because these studies, oftentimes they're done in the Mediterranean. They're done with a lot of variables that are not picked up in these studies. And it bothers me so much when these studies recommend that people do a Mediterranean diet. Like how's a person in Melbourne, Florida supposed to adopt a Mediterranean diet? I don't know how to recommend that, without a lot of painstaking effort to source ingredients. So that's my take on that. So that brings us on to some nutraceuticals because I like nutraceuticals because I have really good companies. I know the dosing, and we can get pretty good effects. And we're going to go through a couple of these. So one is synapsin, and you can get this with your compounding pharmacy friends. I love this because it's inhaled through the nose, goes right to the brain where it's going to exert an effect, and people will notice an effect pretty quickly on it. The ingredients are an RG3, which is a ginseng extract, nicotinamide riboside, so NR, and a methylcobalamin or hydroxycobalamin. We use this all the time in traumatic brain injuries and concussions. We'll use it in inflammatory, so neuroinflammation. We'll use it in autism, in people who have trouble focusing, in people with brain fog. And they breathe this basically brain food right up into the brain. And they oftentimes notice an improvement in their cognition. It's a brain optimization therapy. Lithium orotate. Here's two baths. There's one here in Florida called Lithia Springs, and the famous one in Budapest. Lithium orotate is mood stabilizing, and we're not talking about lithium carbonate. I didn't have too much exposure to lithium carbonate in psychiatry just because it was so problematic. It required all these troughs. It was toxic, all these side effects with it. I had maybe one patient who I inherited who was on lithium, but no one else was using lithium carbonate. It's just too problematic. We're talking about lithium orotate, and it's a mineral that's found naturally in springs. It's essential to the human body, and I think that a lot of the population is deficient in it. Difficult to test for. I haven't really found too many laboratories to test with lithium orotate. So what I do when I have a depressed patient, when I have an anxious patient, I'll put them on a loading dose of lithium orotate because It has mood stabilization effects, neuroprotective. It supports neurotransmitters. It helps brain grow. You can take 5 to 20 milligrams every day as a loading dose, and you will notice the patient will report an improvement within 1 to 2 weeks. Very quick. Sometimes it works too well. And if the patient, if they're on an SSRI already, it might give them too much of a good thing, and they might get a little weepy, a little emotional actually from the excess serotonin. So just be kind of careful with that. Kind of a cool study, I think this was done in Texas. They found that there was lithium in the drinking water, and it decreased the incidence of crimes and suicides and violent behavior in this town. Magnesium threonate, we use this one all the time at the practice. Uh, Richard, you have a question?
Just to point out that they used to put lithium into 7 Up, which is
Seven
why
Up.
it was called 7 Up, because 7 is the atomic number of lithium.
That's right, 7 Up. I never drank that. I don't know if they still do lithium in there. Probably not. So mag threonate. This one is a special form of magnesium that crosses into the brain, and it will either work or it doesn't work. Either patient is like, wow, this really helps with my anxiety, or it doesn't work. Typically, it does work because one, people are magnesium deficient. You can measure that one. That one's easy. Measure the RBC magnesium or cellular magnesium. And you'll find that people are typically around 5.4 or below. You want them between 6 and up to 7 for RBC magnesium. But you can also titrate it. Titrate it to bowel movement. If they have diarrhea, you did too much. If they feel good, muscles relaxed, the intrusive thoughts at night turn off, their brain kind of relaxes, you did good, and that's the right dose of magnesium. Take that every night. So it's neuroprotective, improves cognitive function, there's a couple ways to do it. You can do oral, you can do sublingual liposomal, which might be important for some patients, which we'll get into a little bit later. It relieves anxiety and stress, it improves sleep quality. So I do recommend that one a lot. Ketamine, one of the only, as far as I know, psychedelics we can prescribe at this time. And I urge you all to start incorporating ketamine in your practices. And you don't need to be an anesthesiologist to administer this. We're talking about lozenges. So your local compounding pharmacist, ask them if they can make this for you guys. And it's nothing crazy. They're not going to have a wild, 1960s trip. They're going to see pink elephants or anything like that. It's used for patients with treatment-resistant depression, with PTSD, major depressive disorder. You prescribe it, they do it in the safety of their homes. 300 milligrams is what I prescribe typically. Under the tongue, it dissolves within a couple minutes, and then they sort of like float off. They lay on their bed, they have a nice little experience, and they do it once a week. Typically, we do it in a protocol of 6 weeks. Oftentimes, they're doing some cognitive behavioral therapy, maybe EMDR, maybe neurofeedback. Might be important because sometimes they can have new awakenings. I don't know how to describe. They have new insights, and they might need someone to help process them through the new insights they might get from this. And so we've had a couple good reports from this, and really no negative side effects, if anything. It's very mild, nothing crazy. Mechanism of action of esketamine. That's the intranasal or ketamine lozenges. Esketamine blocks the NMDA receptors. It increases glutamate activity. Glutamate surge promotes BDNF release, so it can help with brain regeneration. Now, I haven't used it in traumatic brain injury or any neurodegenerative conditions yet. I've only used it in mental health so far. But I'd like to start applying it more in neurodegenerative conditions as well. Now we get to leaky gut, which unfortunately is an increasing problem. This is an 18-year-old female. She developed hair loss. She has had the hypothyroidism, T3 of I think 2.3 it was at age 18. Not very good. This testing we did was on a vitamin. So she was taking oral vitamin C. She was taking a multivitamin capsule. She was still suffering with anxiety and didn't feel like her brain was functioning like it once did. Like an 18-year-old should be very sharp, shouldn't have any brain fog. And so look at the serum and cellular here on the right column. So you see cellular on the right, and that's a white blood cell micronutrient test that this company does. And you can see all her B vitamins are on the low end of the reference range. Some are even in the red, like B3 and B1. Now, this is, mind you, she's taking a multivitamin that included B vitamins in there, and she also ate a fairly good diet. She ate meat, it wasn't like a vegan or anything. Vitamin C, super low as well. So this capsule is non-therapeutic. So what is going on here? Well, we did some further testing. We can see that she has a couple food allergies as well, peanuts and soy, wheat, like kind of off the chart here, a bunch of food sensitivities. A lot of micronutrients, K1 deficient, K2 deficient, vitamin D deficient, and of course, arachidonic acid off the charts. Probably not the best omega-3 rich diet, which we needed to supplement that, of course. So this patient has the leaky gut. We diagnosed her with that. She had a positive intestinal permeability markers. I don't know if we have any of that here. Maybe have to bring that back. Um, Positive intestinal permeability is anti-gliadin antibodies, anti-zonulin antibodies. She had all of those. She even had LPS. And so when you have this gut inflammation, the gut is going to affect everything, including the brain. So you can get depression, you can get schizophrenia, chronic fatigue, all these problems. You can get Alzheimer's. That's one to look out for. How food sensitivities, gluten problems, intestinal permeability can negatively affect the brain, especially if they have LPS, lipopolysaccharide. But the other problem is that they don't absorb vitamins very well. So they'll get micronutrient deficiencies, not just even if they'll take a multivitamin, they'll take the everything you prescribe them, you check their blood levels and it's not there. They're not absorbing it either. It's cellular, they're not absorbing it. There can be competitors like we learned about in iodine. There's competitors, halides, there's bromine, and there's fluoride. There's competitors for a lot of vitamins and minerals. There's toxic metals that will compete out for certain minerals. But then the B vitamins, just the malabsorption is super common when you start testing these young women with anxiety problems, with food sensitivity issues, depression. You will find so often that they're B vitamin deficient. And we know the B vitamins are essential for brain optimization. And don't even get me started on the iron deficiency that's associated with that, which I think I'm going to talk about in a bit. So this is what it looks like. Zonulin, uh, we have the loose and tight junctions. There's only one intestinal barrier. It's this one cell line, these epithelial cells. And once they're broken, then you can get food that enters into the bloodstream, and then you can get multiple food sensitivities like we saw previously. So you got to try to regenerate that while replenish them with vitamins that will actually absorb. Now, here it is. This is what I was looking for. Maybe I'll put the slide up a little bit. This was her panel. You can see the gliadin, anti-gliadin, gamma gliadin, anti-zonulin, anti-actin. So very, very problematic gut injury here. So we gave her sublingual vitamins. They started absorbing a little bit better. She felt better. Mental clarity improved. Anxiety improved. That's one way to do it. You can do them IV as well. Kind of difficult, expensive to bring a patient in for IV vitamins all the time. Or you can do intramuscular. The problem with intramuscular is you have to inject them and then you can't inject all the vitamins. This patient also had the estrogen dominance as well going on here. So you can see low progesterone in a young female tested on day 21 and high estrone and high estradiol. So this patient was having poor estrogen detox pathways and low progesterone. And we all know that without progesterone, you have anxiety too. Here's two examples of other women with anemia, iron deficiency anemia, causing anxiety, palpitations, poor poor exercise tolerance. This lady in particular, 28 years old, she was describing that in the past she even needed blood transfusions. When she was a vegan, she had a hemoglobin of 3, I believe, very low. hemoglobin of 3. Um, I tested her, and she had again the wheat tumor score above 6, intestinal permeability score high, antizonulin, LPS, anti-actin. I told her to get off the gluten, and she reports back to me that she ran the fastest marathon she ever ran. She could actually swallow food without feeling like she was choking. She didn't feel fatigued. If someone has trouble swallowing food and they feel like that's not normal, they need either an endoscopy or at least some gut testing. But avoiding gluten helped her a lot. And so some people have a real problem with that. These are other two patients, two women. I like to talk about this one. This is a 36-year-old woman, and she thought she needed to be admitted to the insane asylum because she was getting all these weird thoughts. She thought she was crazy. This was her blood work. Her hemoglobin was very low. It was 9.7, and her ferritin was 4. So both these women had very low ferritin and hemoglobin, and they felt terrible. They felt anxiety. They felt palpitations. They thought they had, Lyme. They thought they had all these things, that they were just superbly ferritin deficient. And this is an ongoing problem. And it is not so much a problem of medicine. One hematologist described this as a business problem because women, they can't get iron infusions very easily. They have to go to a hematologist office and sit there next to cancer patients getting infusions. We, on the other hand, we can prescribe this. You can administer it in the office. It's very safe, and they can have very quick resolution in their symptoms. So we should consider offering iron infusions for anemic young women because this is a huge problem. And it's again comes back to the leaky gut, their malabsorption, intestinal inflammation, and then of course you add on autoimmune conditions, and you have a recipe for iron deficiency anemia. Yes, Dr. Emmerling.
Yeah, Stefan. Yeah, I saw a lot of iron deficiency in my practice back in New York. Not all kidney related, but of course I saw that too. A couple of things that are of interest. One is that all these neuropsychiatric symptoms are symptoms of iron deficiency and are seen without anemia. So you don't have to be anemic to have these neuropsychiatric symptoms. They are very dramatic and they improve with iron repletion. I gave a lot of IV iron in my office at one point until I had a bad anaphylactic reaction in a pregnant lady.
Oh no.
Right. I mean, she was going to have trouble with her pregnancy. She was so totally iron deficient. She was not going to get through her pregnancy. So I thought it was worth a risk. She tolerated the first injection very well. Second injection, she had an anaphylactic reaction. Fortunately, I had a good crash cart and an experienced nurse with me in the room, and we were able to get her, well with, epi and steroid. But it is dramatically good. Now, there is an oral preparation, ferric citrate,
Hmm.
which was introduced as a phosphate binder in nephrology. But it turned out that it was such a good iron source that we switched to using it as iron repletion. So with like a few weeks to a month of oral ferric citrate, you can completely replenish depleted iron stores.
And the dose I heard from a hematologist, you can't absorb more than 5 milligrams per day. Is that right?
Uh,
Like,
I don't think that's true. I mean, iron metabolism is complicated, has to do with hepcidin, ferroportin, and these, but true iron deficiency is readily reversed with ferric citrate. I mean, we had patients who were ferritins of undetectable,
hmm.
low ferritin, low transferrin saturation, low MCV. I mean, absolutely classic, like this patient. And within a month, they were back to normal. Pretty, very, very dramatic.
Yeah. They need it. I think we all need to be at the forefront of treating this thing because it's so common, especially young women.
Yeah, and the infusions are mostly safe. You just have to be prepared with,
If
Benadryl and the usual
Yeah,
stuff.
there's sometimes they'll get joint pains. They're transient uh, with uh, with Venifer. I found that a couple times, but
Oh, Stefan, a tip for oral iron. For maximal absorption, you definitely want to give it every other day. The rationale for that would be the increase in hepcidin. if you actually give it good consecutive days, and hepcidin would hold on to the iron instead of being utilized by the system. So that's a trick that I learned in A4M.
All right. And do you think there's anything to adding vitamin C to your oral iron? Your
Oh
con
yes, definitely. That's
okay.
always going to be a yes.
I always say yes. The conventionalists, they don't like vitamin C for some reason. I don't know.
I don't know why. That's a proven fact, I guess. So, but yes, always add vitamin C.
All right. Then we get into some more repurposed drugs here. Low dose naltrexone as an anti-inflammatory for the nerves. We use this all the time at our practice. Fantastic drug. What is it? It's an inexpensive drug. It regulates immune dysfunction, discovered inadvertently by Dr. Bihari when he was treating HIV patients. He found that when he gave them naltrexone, their immune systems got better. Mechanism where how it can help for brain health and inflammation. It's it binds and acts as an antagonist to toll-like receptor 4. This action disrupts signaling pathways, reducing the synthesis of inflammatory substances like TNF alpha and interferon beta. As a result, it attenuates the pro-inflammatory profile of activated microglial cells in central nervous system, which are associated with pain, fatigue, and cognitive dysfunction. We use this all the time for nerve inflammation at the practice, chronic pain. Of course, it will also work for addiction. We find it will work for alcohol use, of course, whether it's conventional dosing, where that's 50 milligrams, 100 milligrams, but even low dosing, like between 1 milligram and 5 milligrams, it can have a very mild anti-alcoholic effect where they don't even think about alcohol. That's described to me. They'll say, I didn't even think about it. Like these are who's the day drinkers, couple beers a day, every day. They start LDN, they feel good, they don't have pain, and they forget to drink alcohol. And how important is that for an alcoholic? It will, of course, work as an opiate antagonist for heroin addicts. I don't deal with so many of that. We've also found it helps with binge eating. And so it could decrease addictive binge eating behaviors. So that's another mechanism how it works on the brain. A little bit mysterious why it works, but it does. So much that even Big Pharma has started adding it to their Wellbutrin for weight loss and binge eating disorder. Because Wellbutrin, as I should say, a lot of psychiatric drugs, they're used off-label, and Wellbutrin is one that was used for binge eating disorder. It seems to have like a bit of an appetite suppressing effect. It works on more than 160 diseases. Autism, we use it a lot in autism. It improves autistic behavior. We've seen it many times. Anxiety, because it helps release endorphins in the brain. So it's great for anxiety. They take it at night. They don't have as much anxious thoughts. Of course, we'll use it in cancer as well. Methylene blue. Let's talk a little bit about methylene blue. It gets a lot of hype these days. I hear everybody talking about it. Has a lot of different mechanisms where it might help with energy as a mitochondrial enhancement. Uh, it does help with mood disorders, so much that you need to be careful when a patient is on an SSRI that it might give them, again, too much of a good thing. They might get a little serotonin syndrome from too much serotonin. But methylene blue can increase serotonin in the brain, so it can work as a bit of an antidepressant, anxiolytic. We found it oftentimes helps patients just with enhancing their cognition. So it is a brain optimization therapy if there ever was one. This patient, cool story. She was suffering in a water damaged building. She couldn't move out at the time, so she was taking methylene blue, and she described that her brain fog improved. She previously couldn't finish sentences. She started speaking clearly again. It was almost night and day for her as a brain optimization therapy. Of course, you got to get out of the multi building. This one is an amazing case I had. This was a 79-year-old Alzheimer's lady, dementia. She was combative in the nursing home. She would punch the nurses. She wasn't pleasant to her family members. She'd yell at people. Really, really unfortunate. We got her on methylene blue. I was like, well, let's try this thing. Let's see what it does. She became the sweetest old lady. She liked to hang out with the grandchildren. She wasn't abusive to the nursing staff anymore. And they ran out of it, and there was a bit of a delay, and my phone was blowing up. The family was calling me like, "We need to get her this overnighted, like right ASAP." And I was like, all right, let me prescribe this thing. Prescribed it with a different compounding pharmacy that was local, and it didn't work as well. It gave her it. I was like, oh, maybe it was like a placebo. I don't know what it was about that compound. We switched compound pharmacy to the other one, overnighted it, and that one worked. So. Yeah, so it's cool when you're working with an Alzheimer's dementia patient because they don't know what they're taking. So like the placebo effect is like very minimal with these patients. And it's kind of cool to see like difference we got one common friend. I don't think this stuff worked. It was junk. Got another one, and this thing actually worked. So really cool case there. And then our favorite is the hormones. Of course, we need to talk about hormones when we're talking about mental health and brain optimization because they're all neuroprotective. They all help regenerate the brain. DHEA is very important for all sorts of things. Uh, but let's talk about a practical reason why it might be helpful. This is a 60-year-old patient, and she was embarrassed to ride her horse since she had incontinence every time she rode. And it gave her a large amount of embarrassment. She didn't like to tell anyone, so it was affecting actually her mental health. And so, in psychiatry, we're supposed to stay in our lane and only treat the brain. But all the way on the other hand, on the genital urinary system, this lady was having incontinence and it was causing her to have mental health issues because it's embarrassing to her. We regenerated her her vaginal area with DHEA. We did DHEA suppositories combined with estradiol and testosterone. And just kind of an illustration how everything's connected. Try to convince my conventional colleagues of this, that you can't just treat the brain. Everything works together here. Now, here's another example. 45-year-old perimenopausal, night sweats, fatigue, insomnia. She didn't sleep well, and this has been going on for 6 to 8 months. You can see her salivary hormone levels very low, testosterone less than 5. Estradiol, of course, took off a long time ago. Still producing estrone, which is kind of typical. Their own fat cells, she's a little bit heavier weight, their own fat cells will produce estrone, which is a bit of a problematic one if it's left unchecked. Not much progesterone left in the body, too. That one it took off some time ago. We put her on these things. We put her on topical progesterone estradiol. She said, I haven't felt this good mentally and physically and just overall in probably over a year. I haven't been having any night sweats or PMS issues. I'm sleeping 7 to 8 hours. And what's more important than sleep for brain optimization? Because if you don't sleep, you got no brain real quick. So, and the testosterone improved her mood. So she felt great with this hormone therapy. It's a mood improver. This patient, I love this case. You've probably seen this before. It's one of my favorite ones. This was a topical estradiol case. We turned her hands into sclerotic, almost like dried up, mummified hands. She couldn't move her fingers. They were all fibrosed up. It was idiopathic. The dermatologist didn't know. They were just giving her corticosteroid creams. It wasn't getting any better. We put estradiol topically on her hands, regenerated her hands. Uh, and again, this was affecting her mental health. She was wearing gloves. She wouldn't go out because she was embarrassed. She became a recluse in her home. Uh, and that's a huge problem in psychiatry. When I did psychiatry, I would do telemedicine. I worked in this chair right here, and I'd see patients virtually in Massachusetts. A lot of these patients, they were recluses. They wouldn't leave their home for one reason or another. And, I was trying to figure out, like, why does each patient not want to leave their home? Why are they not going out socializing? Why aren't they being out part of the world? Everyone has their own reason for it. This lady, she was embarrassed because of her hands. So again, it just shows you how dynamic mental health and brain optimization is. And here we go, hormones saved her. Progesterone for insomnia. We all know progesterone is sedating, helps with sleep. That's why we give women. It should be first line therapy. I don't think it's really caught up in psychiatry. Actually, it hasn't. When I worked in psychiatry, I think first line therapy was, of course, lifestyle, blah, blah, blah. No one actually believes that in psychiatry. They just say, yes, lifestyle therapy, but no one actually believes it. They just go to the sedating, atypical antipsychotic drug. Like, okay, well, we could try olanzapine. It's sedating. Might make you gain some weight, but it'll help you sleep. That's psychiatry for you. I think progesterone should be first line therapy for insomnia because it works. It converts to allopregnanolone and they sleep better, right? This patient was using alcohol to sleep. That's a super common problem in psychiatry. Patients self-medicate, probably because they are not getting the right treatment from psychiatry. So where they go? They go to 7-Eleven and they get a six pack or they get whatever liquor they can get off the shelf and they drink. So this patient was doing that. She was drinking whiskey every night to go to sleep. And she'd been doing that for years. Other patients, they'll reach for the marijuana, the Mary Jane, because it reduces their anxiety, helps them wind down at night. Or they'll go to Benadryl. They'll go to Walgreens, they'll get Benadryl, which we now know Benadryl increases Alzheimer's. Now, why might Benadryl be increasing Alzheimer's? In my opinion, it's because they're not getting good sleep. Right? It's not a really good sleep aid. Right? Might be other reasons for that, but that's just what I feel is Benadryl. No one really knows why Alzheimer's it might be associated with Benadryl, but it is. So progesterone for insomnia should be first-line therapy. Here's a spicy one for you guys. Nandrolone pharmacology. We use nandrolone in low doses at this practice. Um, Nandrolone gets bad reputation because bodybuilders like to do too high doses of it. And when you do too high doses of nandrolone, it converts dihydrotestosterone, causes your hair to lose and the prostate to grow, causes estrogen as well. They get nipple growth, estrogen dominance. If you low dose nandrolone, it's very nice as an anti-pain medicine. So it helps with pain management. It helps build muscles, and it has a mood improving effect as well because it is a testosterone analog. So these are a couple of cases I have of patients improving their pain with nandrolone. This 56-year-old lady, she loves the mood improving effects. Her knees also feel more stable and less pain when playing tennis. 61-year-old drywall worker, he had a big fibrosis in his palm from holding a drywall pan for years. You get a little bit of nandrolone, was great for his pain and helped his mood. 55-year-old asthmatic with osteoporosis from chronic corticosteroid use. We put her on nandrolone for the bone improving effect on this and improved her exercise tolerance, decreased her need for asthma meds. 66-year-old with psoriatic arthritis. He couldn't afford the DMARD therapy. We gave him a little bit of nandrolone, a little microdose, like a couple cents, once a week, and it was enough for his pain relief that he could live his life. And this is my mom. She loves testosterone and nandrolone. She says it makes you feel sexy and confident, but not overtly so. If you do too much, it gets over the top, in her words. So a little bit goes a long way with nandrolone. And her back pain improved. She used to have chronic back pain. Might be from, I think she has a little osteopenia. The nandrolone has improved her back pain. She's able to bend over, touch her toes, which she previously wasn't able to do. She's stronger now. She can hang from a pull-up bar for 60 seconds or more. Try doing that. So in summary, there's four pillars. We got to talk about the diet, strength training, light therapy, cold exposure when we're talking to our depressed patients or patients who want to optimize their brain health. So all of that goes into that. We have to look at their micronutrients, look at their intestinal permeability. We have to then address sublingual or IV therapies to get the nutrients in people to optimize their brain. Then, of course, we need to look at the hormones, all the hormones, estradiol, progesterone. They're great for mood stabilization, for neurogenesis of the brain, for pain management, and then other therapies to consider. Low dose naltrexone, methylene blue. They're nice immunomodulators, anti-inflammatory. They also help brain optimize. And then as a last option, the SSRIs. I mean, I still will prescribe an SSRI here and there in my practice, but it's not a first-line therapy. There's like all these pillars to do before you get to the SSRI, before you get to the antipsychotic. But I don't know the last time I prescribed an antipsychotic. But that's kind of the pillars we all need to think about. And I'll take questions at this time.
Yeah, Stefan, that was excellent. My question has to do with have you been keeping up on, I guess I consider it newer type of research on creatine and higher dose creatine for cognition, mood, and memory? We're talking like 20 milligrams a day, stuff
20
like
grams,
that.
20 grams a day.
20 grams, yeah. 20 grams a day. Have you been hearing about this yet?
No, but I know it's been done safely, even in neonates in the ICU, upwards of 20,
Yeah,
30
it's
grams.
extremely safe.
Very safe. Yeah, I wouldn't be surprised about
Yeah,
that.
it's not just, the muscle growth and the bros and all that kind of stuff anymore. They're finding some amazing therapeutic type of stuff. I didn't know if you'd been checking that out or not.
Might add that, and my lecture's getting long enough for this talk, so I don't know.
I
I'll have to take some stuff out,
don't
actually.
want you to add more, but
How long did I went an hour and I have to do this in Italian? I gotta take some stuff out of this.
Um, Stefan, what's your dose on the nandrolone?
Less so 0.02 ml. So that's like 2 units is what a female will do once a week. And that equates to about 4 milligrams.
Okay. And for the males?
About 20 milligrams a week or less.
Okay. So it's a once a week, it's an injectable.
Once a week. It lasts about 14 days, but it starts hitting a, a low level around day 5 or 6. They'll start. My mom's favorite day is Nandrolone and tea day. It's where dad will give her a little microdose injection of Nandrolone and tea. She really looks forward to that day. She feels euphoric.
I don't know if you should be subjecting your mother to all these
Oh,
all these things.
she'll maybe I'll get her on the Clearfield show sometime. She'll tell you all about it. She loves it. She loves talking about this stuff.
All right. So Dr. Hall asks, are there any differences between men and males and females in the cold plunge results?
As far as what, like mood, pain, because everybody notices a difference, no matter what gender.
Uh, Dr. Hall, if you're there, do you want to elaborate or not?
Yeah, I'm here.
Okay, there you go.
There's been some discussion recently that I've seen online about cold plunge not being as effective or as appreciated by the female body. I'm a gynecologist. I'd like to think that it is beneficial for women, but if there's declining results with it for whatever reason, okay, whether it's for brain health or um, brown fat, white fat changes. But I wasn't sure if you had seen any differences in the scores because your scoring system is amazing. I love that. What you were looking at, all the different parameters. And I'm wondering if women had the same type of improvement or the degree of improvement that you saw with men.
Mm. With the women who come to us, they come there typically for a reason. And I'd say the most common reason is pain. And the pain is genderless, and it always improves with the cold plunge therapy. But if we're
Mm.
talking about mood, women feel great from it. I mean, I had one patient tell me it was like doing cocaine. I was like, oh, I don't know if we want to advertise that. My mom describes a euphoric feeling every time she gets in there. She does 3 minutes at 36 degrees Fahrenheit, and she just feels this euphoric feeling afterwards. She loves it.
Thanks for letting me know that.
Yeah.
Dr. Ammerling, you got
Hey,
a raised
hey, William. Yeah, so Stefan, I really enjoyed the talk, of course, and I noticed in your slide on the sauna that you observe or they observe raised renin aldosterone levels.
Yeah.
As a nephrologist, I cannot see any good in that. Okay, just in general, my explanation is that you're causing significant vasodilatation, which creates a relative state of hypovolemia because the blood volume is now filling a larger space, and suddenly the kidney perceives hypovolemia, and it puts out renin and angiotensin and aldosterone to try to correct it. So my suggestion would be that before you do a sauna, that you tank up on salt water to make sure that you're really fully volume expanded. And in that same vein, the Roman baths are considered to be the first intentional dialysis treatment,
Hmm.
in that you would sit in there for a day, sweat gallons, literally you'd sweat gallons out, and you'd replace that with water and or wine, which is what they they used back then. So that if you sweat out 10 liters and replace it with fresh water, you've done a 10-liter dialysis, which is basically what a day of peritoneal dialysis would be worth.
Wow.
So, so it's very beneficial, but you must replace the electrolytes in the water.
Yes, critical.
Okay. Next question, Dr. Leonard. Synapsin, how often and for how long?
Well, synapsin is used daily for traumatic brain injury. If we're using it for a nootropic effect, so I'll have patients they need to study something very intensely, they'll do it before that. If we're using it for autism, that's usually as needed basis. Sometimes these autistic childs they'll actually ask for it. Like they'll know when their brain needs something, and they some of these children they will request these things. Like for example, low dose naltrexone. There's one patient who he'll request his LDN when he knows he's going the wrong way. So it's used as an as needed.
Okay. Okay. So Dr. Arnott says that ketamine helps my neuropathic pain for at least a week after an IV infusion. Also feels like a neurotropic, likely due to neuroplasticity and neurogenesis. Most effective treatment for his PTSD, 6 infusions, corrected years of mood issues, and failed SSRI, SNRI.
Mhm.
So I actually have taken the IPI course in ketamine. I would just caution that you really need to know what you're doing because things can go wonky quickly, and you need especially if you're doing IV ketamine, you need resuscitation equipment available to you, and you need somebody that's trained in like Dr. Burgess in psychedelic experiences. So I would be a little careful with ketamine. I don't have any really much experience with this nose spray, nasal spray, or the lozenges. The IV form, at least I think in a lot of places, a lot of states, you need a special license for it. I mean that's my understanding of it anyway.
Yeah,
So
IV is different. I mean, the oral and intranasal ketamine is very different than the IV. I think the IV is more potent, obviously more risky, and the oral is pretty safe, though, with lozenge, I'd say.
How long does the cold plunge last? I think you already told us that, right? 2 to 4 minutes is the usual.
The how long you're in there, yes, 2 to 4 minutes, but the duration of benefit, it depends on how severe the pain is, and it's person dependent. But the patient, depending how bad their pain is, sometimes they're in there every day to get a 1 day effect. Some need it only 3 times a week or occasional use. Depends on the
Mhm.
person.
Okay. Dr. Arnott, again, don't forget the neuroprotective effect of cannabinoids for neurodegenerative diseases, and they've allowed him to be pharma-free for neuropathy, excluding LDN. Okay.
Just to add to that, the antidepressant effect of cold plunges. So they found on studies that the spike of dopamine is almost like 200, 250%, and norepinephrine, 500% even for hours. So this actually puts you in that state of lessening depression, even increasing focus.
Okay, and there's some comments here that the crowd would like Mrs. Hartman, your mother, to give us a talk on her diet, lifestyle, and anti-aging.
Yeah, we can do that.
You think we can arrange? You think we can arrange that?
Oh, she'd love
Booker,
to.
Huh?
She'd love it.
You think Mom would come on?
Yeah, 100%.
You would. Okay. How about November 11th?
November 11th, we'll be in Bologna, Italy. She's coming along with me for the talk.
All right. How about the 25th?
Yeah, 25th, we'll be back by then.
All
make
right.
sure it's Nandrolone Day. She's going to be in the
Yes.
middle of the
Yeah,
lecture.
make sure it's an Angelo Day. All right.
Okay.
I'll talk to you about that another time. Let's see, there's more here. Dr. Benaria, you got any?
Yeah, so in the chat here, in the email, so we have some, I guess, curious cats about, so the thing with, So what are in your experience, sounds like you've been doing this a lot. And what are the common mistakes do people make when trying to optimize brain longevity and how they can avoid them? So this is basically more of a clinical question that you see in patients.
Mistakes would be, well, I think we have get patients that come to us with an open mind and realize that everybody's unique and they're going to, the responses to things are going to be unique and it's going to take time and tinkering to find out what works best for them. Yeah, it's not one size
Right.
fits all.
In my end, I always see about people you buying all these nootropic supplements, thinking that that's going to be their one-stop shop. And even I'm sure you heard of uh, supplements out there that doesn't even have claims, but they forgot fixing the gut. So you mentioned about the gut a while ago. So the microbiome has always been a neglected part of the body. Everybody's thinking about this, but they're not thinking about the brain down there. So that's one of the things that I've seen in my own experience.
Oh, yeah,
And for the clinicians here, so you've mentioned so many things about how we can optimize brain function. So what strategies I mean, your favorites in terms of how not to overwhelm patients?
we do things one at a time, and I have them report back to me on how things work. I say, listen, let's try this lithium, 20 milligrams. You can do it every day. Send me a portal message in a week or two. Let me know how it worked. Either going to work or it's not going to work. You just let me know. Then we take it from there. Next step.
And then you combine the cryos with that, or that also is another step.
Well, it's the pillars, right? You got to do all the lifestyle. Everybody should be doing strength training, diet, sauna, cold plunge, basic stuff. Red light therapy. I mean, red light therapy is maybe a little bit extra, but even some of the basic stuff. Things that are difficult, like cold, it's difficult. Exercise is difficult. You need to earn your dopamine, right? People want the cheap dopamine. They want to go for the SSRI. They want the cheap solution. You got to do the hard things. Once you've done the hard things, master the basics. Okay, then we move to the next pillar. Okay, but the next pillar might be looking at some nutrients. Okay, let's try some magnesium, lithium, some low-hanging, always deficient nutrients. We see how they go. And then after that, of course, and maybe in conjunction with that, looking at the hormones, right? Nutrients and hormones, one and the same for me. Optimize all the hormones, of course. And then if all those fail, you're still struggling. Oh, let's look at ketamine. Let's look at low dose naltrexone. Let's look at methylene blue. Now let's try some other things that are a little bit more advanced down the road.
Right. So again, this is where your individualized discretion comes into the play. And that's why when people want to do this, just by reading through blogs, you really need a clinician, especially when you're talking about complicated situations such as this. So that's why that's definitely something that I would highly advise, especially when you're going into this rabbit hole now and buying all these supplements left and right, thinking that will help you. You really need special practitioner like Stefan here. And here's a question about tech. Is tech something that you're using? So one of the things that they pointed out here is like the Aura Ring or any other tech that you use to coincide with the interventions that you just mentioned.
Aside from lab analysis, patient reports, no, not a really good tech tool I've found. Or a ring, my wife wears that. It's kind of interesting because she'll see all this hormonal fluctuation, and there's always something at some part of the month, and she can attribute that to one of the hormonal changes in the aura ring. So it like validates her feelings. I don't know if that's a good thing or a bad thing. It does validate her though.
Yeah, I mean, it gets complicated. I've played around with the app. There's so many graphs, there's so many numbers. But again, it all ends up like, how is your patient feeling? I mean, that's what I kind of like narrow it down to. But yeah, it's out there, it's helpful, but it's all about the clinical presentation and also combine it with numbers, right? Physical exam. They won't understand that. There's only us clinicians probably who would. All right, so they've seen cryo, they've seen baths, the ice baths. Which one for what? How do you choose which for which in what case?
If the patient is not mobile, they cannot get in and out of the cold plunge. They need to go into one of these walk-in chambers and freeze them. If the patient has a wound or something, they can't get into the cold plunge. I mean, that's another reason. Or cost. If they they can't afford the walk-in chambers because those are very expensive. Like a session is, I think it's like $50 around where I am every session you go. Where my gym, it's like 24/7. They come whenever they want and they can do the cold plunge whenever they want. It's only $100 a month. It's a great value.
Right. Well, in my experience, I done both. I I really felt colder with the plunge. The cryo, sure, I felt it too, but I think the experience is really going into the bath, the ice bath.
Yes.
So if you want that pure experience, the knives like striking your body, it's the bath. Okay, so let's get this last question in. Looking forward, what emerging trends in the optimization industry that you just mentioned that you are kind of looking out for in the future?
Psychedelic therapy is a growing field. We're going to keep seeing more of those come online for mental health problems and brain optimization. And then maybe we're going to get a resurgence or new research on some of these peptides, hopefully. We're relying on a lot of Soviet Union studies right now. That's why I didn't talk a lot of the potential peptides, but there's dihexa, there's cerebrolysin, there's semaxilink, and I've dabbled with all of these with patients who want to experiment with them. But we only have old Soviet Union studies to rely on right now.
Right. Yeah, and there's more out there. Brain taps. There's a lot of new devices. I worked with Bredesen protocol patients here, and even Bredesen is kind of moving outwards. So there's even that galectin-3 infusion to lower down the chance. I mean, to prevent Alzheimer's, to even control it. So the future is so bright with this that it's just growing. But the point there is, let's not be late getting on the track. We ourselves need to try it to make sure that these brain cells of ours are still running by the time we're 80 or 90.
Yes.
So anyway, you got it all out. Thank you for a great presentation, Stefan. If you know, we're going to miss you in December. So if you have a change of heart, we're always going to be here. So
in Reno, right?
Reno.
I got a couple more questions if you can hang out, Stefan.
Sure.
So are you using methylene blue for IV methylene blue for neuro health?
No, it's prohibitively expensive. I haven't found a cheap source for that.
You can make sure no SSRIs or issues with low nitric oxide improve rather than reverse, but some may have drastic improvements from what I've heard, Dr. Arnott. Okay.
Oh, okay.
All right. There's a question about what pharmacy you use. Wait till we're done with the video on that one. Okay. IV is a different ball game for ketamine versus Trochet or RDT. Way more intense. You need good set and setting and caution.
Right.
And then a question about classes, and we won't mention that. Okay. Wait till the video is off on that. Okay.
Great.
So thank you so much. Anybody else have any comments or questions or anything else? Question about how much does a cryo machine cost?
The one I have, it's like the Cadillac of cryotherapy, of cold plunges. It's like $30K.
Okay. Lithium orotate for 20 milligrams per week and then cut back or keep them on it.
Yeah, you start them on a loading dose to get a nice quick effect so the patient knows that something's happening. And then you can do a lower dose, kind of like we would do with iodine therapy. We like start them out a little bit higher, saturate them, and then you can do like a milligram a day. It's fine.
Any issues with bundle branch block from lithium?
No, you may be thinking of lithium carbonate.
Right. Okay. Hang on. There's one more here. Okay, that was nothing. Okay, Dr. Inario, you got anything else officially?
Officially. No, he got it all out.
Video's off now, so